Hello, my name is Teresa Lee, and this is my musculoskeletal assessment video for msn572. Today is June 17th, 2024, and I will start with my 360 room scan. So we've got the first, second, and then we've got the third, and then there is a room in here, but there is nobody in there and nobody helping. And then I've got the fourth wall. And then we are back to the front. And then I'm going to start my floor scan. And then I just wanted to show the couch here, as we do have one. Okay, and then the ceiling scan. Okay. Okay, so we're gonna go ahead and get started. But before we get started, I just wanted to ask for, if I do have your consent to do the assessment as well as posting it on YouTube as unlisted for my instructor to grade.
Yes.
Perfect. So we're gonna go ahead and get started. I'm gonna start by just sanitizing my hands here. So hello, my name is Teresa Lee. I'm a family nurse practitioner student, and I'm gonna be performing your musculoskeletal exam today. So we're gonna start just by inspection of the hands. So looking at the hands, in the fingers, I don't see any redness, no swelling, no deformities, no muscle atrophy, as well as no signs of inflammation. Upon palpation of the distal and the proximal interphalangeal joints, I don't feel any nodules or masses. Did you have any pain or tenderness?
No.
Perfect. So next we're going to perform some range of motion. Go ahead and just follow my motions here. So we're going to flex your fingers down, hyperextend up, make a fist, and then abduct and then adduct. Perfect. And patient was able to perform without any difficulty and with full range of motion. Next, I'm going to palpate his wrists, or I'm going to inspect his wrists. And again, I don't see any signs of inflammation, no redness, no swelling, no deformities. I'm going to go ahead and palpate the carpals and the metacarpals. Any pain or tenderness there?
No.
Perfect. And I don't feel any nodules or masses. We're going to go ahead and perform some range of motion. So go ahead and follow my motions here. Go ahead and this is flexing up or flexing down, and then extend up. And then we're going to radial deviate and then ulnar deviate. Perfect. Next, I'm going to test your median nerve. So we're going to go ahead and do what's called a Tinel's test. So I'm going to have you hyperextend your wrist out, and then I'm just going to tap your median nerve here. Do you feel any numbness or tingling or pain shooting down your middle finger or surrounding fingers? No. Perfect. And I'm going to perform that on the other side. And so tapping here, any numbness or tingling or pain?
No.
Perfect. All right, next we're going to perform, so that means that there is no median nerve compression, which could be a sign of carpal tunnel syndrome. So next we're going to perform what is called Fallon's test. So we're going to come in at an opposite prayer position here, and we're going to hold for about 60 to 90 seconds, but for the video, we're just going to go ahead and assess. Do you have any pain or tingling traveling down into your fingers?
No.
Perfect. So again, this is a negative test for carpal tunnel syndrome. Okay, so next I'm going to move up and inspect the elbows. I don't see any redness or swelling, no asymmetry, no deformities, no muscle atrophy. I'm going ahead and start palpating. I do feel the extensor surface of the ulna. I do feel the operon process, as well as the medial epicondyle and the lateral epicondyle, in which the lateral epicondyle, if they're oh wait. Okay, I thought it turned off. Oh my gosh. Okay, so lateral epicondyle is any inflammation there is actually attributed to tennis elbow, and then the medial epicondyle is golfer's elbow. Okay, and then upon palpation, I also did not feel any nodules or masses. Did you have any pain or tenderness?
No.
Perfect. So let's go ahead and do some range of motion. You're gonna go ahead and extend out, flex in, and then pronate, and then supinate. Perfect. Next, just moving up to the shoulders. In clinic, I would have his shirt off, but for modesty, we're keeping it on. So just looking at his shoulders, they are even and symmetrical bilaterally. I don't see any redness, no swelling, no deformities, no muscle atrophy. I'm gonna go ahead and palpate, and I am palpating for his acromioclavicular joint here. His coracoid process, as well as the biceps grooves, the subdeltoid bursa, and then the tubercles of the humerus as I rotate his arm internally and externally. Any pain or tenderness as I was palpating?
No.
Perfect. Let's do some range of motion. You're going to flex your arms up and then extend back, and then we're going to externally rotate, internally rotate. Perfect. And then with one arm you're going to abduct out, and then across the midline adduct, and then same for the other side and adduct. Beautiful. So just moving on, we are going to move on to the head and neck. So I am again just inspecting. I don't see any redness, no deformities. His facial expressions and his face is even and symmetrical bilaterally. I don't see any facial drooping, no muscle atrophy. Again, everything does look midline. I'm gonna go ahead and start palpating. So beginning at the temporomandibular joint, go ahead and open and close your mouth. Perfect. And any pain or tenderness?
No.
Perfect. And I didn't feel any clicks. Continuing my palpations, the sternoclavicular joint here, as well as the cervical spine, the paracervical muscles, as well as the trapezius and the rhomboids. Any pain or tenderness?
No.
Perfect. And I did not feel any masses or nodules. Next, I'm going to perform some range of motion. But before I do some range of motion, actually, we're going to test his maximal mouth opening. So go ahead and open your mouth all the way, and then try to vertically insert 3 fingers there. Perfect. And he is able to perform that. So she's there, as well as moving his mouth side to side. So go ahead and open your mouth and then move your jaw laterally. Perfect. Any pain with that?
No.
All right, so no issues there. So now we're going to perform range of motion. So I'm gonna have you flex your head down. We're gonna hyperextend up, come back to midline, and then we're going to laterally rotate, and then laterally flex, and lateral flexion. Perfect. So next I'm going to perform what's called Sperling's test. This is testing for cervical compression. So I'm gonna have you just turn your head slightly to the left and up, and then slightly to the left and up, and then I'm going to just apply some compression here. Let me know if you feel any pain radiating down your arm.
No pain.
Perfect. And then I would repeat on the other side. That is testing if, again, there's any cervical spine compression, and I would never perform that test on any elderly or frail populations, as well as anybody with spinal cord injuries. Okay, so next I'm going to just inspect your toes here. So toes are, the alignment is appropriate. I don't see any redness, no swelling, no deformities, no muscle atrophy. Inspecting the bottom of his feet. Also, I don't see any calluses, no corns, no bunions. Now I'm going to start palpating his distal interphalangeal joints, and then his proximal interphalangeal, as well as the metacarpal or metatarsal interphalangeal joints. Any pain or tenderness there?
No.
All right, and then there was no nodules or anything that I could feel. Now I'm going to feel his interphalangeal joints. I'm looking for any nodules or any pain as I'm palpating here for the interdigital neuroma. Do you feel any pain there?
No.
Perfect, and I'm doing it bilaterally. And now for plantar fasciitis, I am going to palpate just the back of his feet, as well as the arches of his feet. Any pain or tenderness there?
No.
Perfect. And I'm just gonna move this so we can see. Okay, so next we're gonna do some range of motion. So you're going to plantar flex, dorsiflex, uh, invert, evert, and then do some ankle circles for me. Perfect. And then with the toes, you're gonna abduct outwards, and then adduct inwards, and then curl your toes for flexion, and then extend up. Perfect. So he was able to perform that without any issues. Next, we're just gonna move on to the ankles. So I am just inspecting again, no redness, no swelling, no muscle atrophy, no obvious deformities. Now palpating any pain or tenderness.
No.
Perfect. I don't feel any nodules or masses there. I am able to palpate for the medial malleolus as well as the lateral malleolus and the Achilles tendons back here and up his gastrocnemius. Okay, so now we're going to do range of motion for your, ankles we already did with the dorsiflexion and all of that. Okay, so next, I'm gonna move on to the knees. So with the knees, I'm just inspecting. I don't see any redness, no deformities. I don't see any, I don't see any nodules or masses, and no muscle atrophy. Next, we're going to perform just some I'm going to palpate actually his suprapatellar pouch here, as well as the sides of the patella, and then the popliteal fossa. And I don't feel any Baker cysts in the popliteal fossa. And then I'm just gonna repeat that on the other side with the same findings. Next, we're gonna perform some range of motion for the knee. So I'm gonna have you go ahead and extend just one knee out all the way and then flex it all the way back to 120 degrees. And then I'm gonna go ahead and do that for you as passive. So extension and flexion. And then go ahead and do that to this knee, extension, flexion, perfect, and extension and flexion. Okay. So go ahead and stand up for me. I'm just going to check your knee alignment. So go ahead and stand up, and then just looking at his knees, everything does look straight. I don't see any varus or valgus alignment issues. Okay, so go ahead and lay down for me. So we're gonna perform the valgus and varus specialty tests now. And again, this is just testing the alignment of his legs. So I'm just gonna lift his leg up here. So medially, I'm testing varus stress. Any pain or tenderness?
No.
And then I'm going opposite, so I'm pressing on the lateral aspect of his knee now for valgus. Any pain or tenderness?
No.
Perfect. And then I'm gonna go ahead and perform that on the other side. So here I'm coming medially is varus. Any pain or tenderness?
No.
Okay, and then valgus. Pain or tenderness?
No.
Perfect. Next, I'm going to perform what's called Lachman's test. In this one, I'm going to have you bend your knee at about 20 degrees, and then I'm going to hold the femoral or the distal end of the femur here, and this is testing for just ACL and PCL laxity. I'm going to just push and pull on his tibia here. Any pain or tenderness?
No.
Perfect. And then I'm going to do that to the other side. So I'm just, again, stabilizing my femur and pushing and pulling the tibia. Any pain or tenderness?
No.
Perfect. So now I'm going to perform what is called McMurray's test, and again, just testing for any like pain, tenderness, crepitus, which could indicate the ligament laxity. So again, I'm just going to, I'm gonna stabilize my femur here, and then I'm just going to externally and internally rotate the tibia here. Any pain or tenderness?
No.
Perfect, and that is a negative sign. Lastly, I'm going to perform what's called the drawers test. So I'm going to just brace his knee up and bent, and then I'm going to posteriorly push and then anteriorly pull to test his the hip and sacral joints. So coming here and pulling and then pushing in. Any pain or tenderness?
No.
Okay, and then pushing and pulling. Any pain or tenderness?
No.
All right, so that is a negative test. So he doesn't have any impingement or like deformities in his sacroiliac joints. Okay, so now we are going to assess the hips. So go ahead and stand up for me. Okay, so looking at the hips, it does appear not midline, but they are equal symmetrically, and they are equal and symmetrical bilaterally. I don't see any redness, no deformities, no swelling, no muscle atrophy, and again, his posture is upright and straight. Next, I'm going to start palpating. So I am palpating the anterior superior iliac spine, as well as the greater trochanters, and then the posterior superior iliac spine, and then the sacroiliac joint right in the center there. Okay, next I'm going to just have you bend or flex your knee all the way up to 45 degrees, and then the other one 45 degrees, and then I'm going to also do it for you, 45 and 45. Perfect. What's next? So range of motion. Okay, so the rest of your range of motion, we're going to abduct your leg out and then adduct across. So this was 60 degrees and then 30 degrees. And then go ahead and do that to the other one. So abduct and then adduct, perfect. And then I'm gonna do it for you. So abduct and then adduct and abduct and adduct. All right, so after that, we are going to do extend or flexion is kicking forward, and then extension is backwards. So flexion and extension, perfect. And then you can go hold on to me, and I'll do it too for you. So flexion, extension, and then flexion and extension, perfect. Any pain or tenderness there?
No.
All right, and it looks like you had full range of motion. So next we are going to do some rotations. So I'm gonna have you so we're gonna laterally rotate. So go ahead and laterally rotate this way and the other way, and then we're also going to laterally flex and flex, perfect. And while I'm here, it's supposed to be with the spine, but we'll go ahead and flex forward and then extend backwards, excuse me. All right, so go ahead and lay down there. So now I'm going to perform what's called the Thomas test, and this is just testing for any like hidden hip flexion contractures. I'm actually gonna have you pull your knee all the way up to your chest. Any pain or tenderness there?
No.
Perfect. And then the opposite hip did stay, it did not rise, which is a good sign. And then go ahead and do that to this side. Perfect. And again, he was able to perform that without any difficulty. Next, we're going to perform what is called the Faber's test. So I'm going to move his ankle just to the top of his knee here. I'm going to go ahead and apply some pressure. Any pain or tenderness?
No.
And then also his hip did not rise, which is the finding that we want to see. That's a normal finding. Again, we're going to lift and put the ankle on top of the knee, and then I'm going to apply some pressure. Any pain or tenderness?
No.
Perfect. And then again, that hip did not rise. So his so this was assessing his hip and sacral joints. Okay. Okay, lastly, we are going to do the spine. So go ahead and stand up for me. And then you're just gonna face that way. Let's see. Okay, so looking at his spine, laterally, anterior, posteriorly, I don't see any cervical or lumbar lordosis. I don't see any dorsal kyphosis. Looking straight from the back, I don't see any obvious deviations. There's no redness, no swelling, no muscle atrophy, and no deformities. Now go ahead and bend forward, 90 degrees, perfect. He's able to do that. And now I'm just palpating his spinous processes along with the intervertebral spaces here. Any pain or tenderness?
No.
Perfect. And then go ahead and stand upright, and then I'm gonna percuss with the ulnar surfaces of my fists. Any pain or tenderness?
No.
Perfect. And I did not visualize any nodules or cysts or anything like that when he bent over, as well as negative for scoliosis. Okay, and then we already did spine range of motion, and that was the flexion and extension, and then the rotations and the lateral flexions. Okay, I think that's it. Go ahead and lay down. We're gonna do our last specialty test, and this is the straight leg test, and it is testing for any compression of the nerves, as well as sciatica. So what I'm gonna do is he's just gonna relax. So you are just going to relax your leg. I will do all the work, and I am just going to lift his leg straight up to about 120 degrees. Any pain or tenderness there?
No.
Perfect. And then he did not show any visible non-verbal signs of pain or tenderness either. And now I'm going to perform it on the other side and all the way up. Any pain or tenderness?
No.
Perfect. So that is negative for any signs of sciatica or nerve compression. All right, I think that concludes our assessment. Thank you so much for being my model.